Hi, welcome to episode 5 of Empowered Menopause. I'm Dr. Gabrielle Francis, and in this episode, we're going to go into a very balanced and non judgmental approach of hormone replacement therapy, also known as HRT. We'll discuss how do you know if it's right for you, what are the pros versus the cons, how do you know if you're going to do it safely. We're going to also discuss the different types of HRT from herbal to bioidentical to synthetic. And we'll talk about the different strategies that can be used during perimenopause and menopause. This is a non-judgmental approach. It's very informative and it'll help you decide if HRT is right for you. So let's go. Many women ask me about hormone replacement therapy during perimenopause. And in general, most HRT is not recommended during the perimenopause time, but if it is, it has to be based on if your hormones are low. I don't recommend just taking HRT, hormone replacement therapy, if your hormones are not low. They need to be tested. And what we typically see is that people often have very high estrogen levels and very low progesterone levels. And there can be other kinds of imbalances as well. So really, during hormone replacement therapy, it has to be monitored and based on testing that your hormones actually need them. Perimenopause is a time where the herbal phytoestrogens and phytoprogesterones can work very, very well. They have a much safer way of working, and they tend to help balance people without taking the HRT. If you're having a lot of hot flashes, just because you have hot flashes doesn't mean you should be on estrogen. You need to get your estrogen tested. It's funny, but a lot of times people who have high estrogen levels and are getting hot flashes will feel better on hormone replacement therapy. And that's because the hormone levels are not fluctuating any level. They're being flatlined by the hormones they're taking. The hot flashes are coming from the fluctuating levels of hormones, not necessarily because they're too low. So when you're determining if HRT is right for you with your doctor, insist that you're getting your hormone levels tested and monitored during this time so that you're only taking what's appropriate for you. We're going to talk a little bit about something called hormone replacement therapy, HRT, which is very popular now with this perimenopause and menopause conversation, but it's really important for you to understand what it means, how it works, and if you're a candidate to do it safely. We'll also talk about the different types of HRT, from herbal to bioidentical to the synthetic to the other types of medical HRT. And so stay with me on this part of the series so you can learn about HRT and when not you're a candidate for it. Before you determine if you are going to do HRT, you have to work with your doctor to kind of see if you're actually a candidate. There's some people who really shouldn't be using hormone replacement therapy. If you're a breast cancer survivor and you have estrogen or progesterone receptor positive cancer, you should not be taking HRT. If you have a family history of somebody with breast cancer, fibroids, cysts, even some people with endometriosis, you may not be a candidate. You have to ask your doctor about that. You also have to be monitored yearly to make sure that you're getting a mammogram, a breast ultrasound, and a pelvic ultrasound to make sure there's no breast cancer, fibroids, cysts, endometriosis, or ovarian cancer. And the reason you have to be monitored yearly is because bioidentical hormones don't cause cancer, but they can feed cancer if you have it. So it's very important to kind of get monitored and make sure you're cleared by your medical doctor before you go on the HRT journey. Many women just assume that because they're in perimenopause or menopause, they automatically need HRT or hormone replacement therapy. They'll say things to me like, I'm in menopause and I don't have hormones anymore. Well, that's not supposed to be true. As we've talked about earlier, In menopause, the ovaries shut down, but the thyroid and the adrenals kick in, and they produce the 20% of the hormones that you need for your second phase of life. Unfortunately, many women don't have those 20% of the hormones because the thyroid and the adrenal have been burned out before they get to that point. So if you've ruled out that you're not a candidate, that you're safe to be on HRT, see the video that I did before. But if you've ruled out that you are safe and now that you can take HRT, it should only be a short time. Our bodies were not designed to need external hormones. As a matter of fact, our body produces them naturally in menopause, and they're coming from the thyroid and the adrenals. So in menopause, if someone's not in that 20% range, I may recommend, if it's safe for her, that she do a small amount of HRT to keep her in that 20% range. But at the same time, we're working on the thyroid and the adrenal and other root causes of why her body is not producing the hormones. So the HRT is a short-term thing while we're getting her body to produce it again naturally. Now that HRT is such a big conversation, I see many ways that people are using it, and some of them I don't really agree with. As you know, when you move into menopause, your body is producing 20% of the hormones that it had before, and that's coming from the thyroid and the adrenals. And many women aren't producing those hormones, and so they can benefit from some HRT. My philosophy is if you are safe to take HRT and you've ruled out the history of breast cancer and the family history of breast cancer, then you may be able to take that 20% of hormones just to keep you in that 20% range. And then you're working on the thyroid and the adrenals, and you stay on the HRT until your body is producing it naturally. Now, there's a lot of people using HRT in more of the anti-aging circles, and they'll have women in their 60s and 70s taking hormone replacement at the level of somebody in their 20s. Personally, I don't agree with that. And a lot of these women are getting periods, and it's like if you test them, their hormones are like somebody in their 20s. We really weren't designed for that. We don't need those high levels because we're not prepping for a baby every month. If you are going to use HRT, I recommend that you ask your doctor to keep you in that 20% normal range, and also be monitoring your hormone levels yearly through blood work, and also monitoring your breast and your ovaries and your uterus to make sure that there's no reason why you shouldn't be taking these hormones. HRT, or hormone replacement therapy, is used differently at different times of the perimenopause-menopause spectrum. If you're in perimenopause, the hormone replacement therapy should be keeping you in that balance of estrogen from day 1 to 14 at higher levels, and it continues on throughout the entire cycle, and then progesterone only in the second level of your cycle from day 14 to 28. So the goal during perimenopause is to keep your hormones in that 28-day cycle, extended through the full cycle, where it's estrogen and progesterone in their natural rhythm. Once a woman's moved fully into menopause, the FSH is high and the estrogen and progesterone are the same throughout the entire cycle, and they're about 20% of what they were before. So if a woman's in menopause, the estrogen and progesterone should be the same throughout the entire cycle. Every day should be the same. And she should also be getting her ovary and her uterus monitored with a pelvic ultrasound to make sure there's no lining that's growing, make sure there's no cancer or ovarian cancer. And she should also be getting yearly ultrasounds of the breast and yearly mammograms. Because even though most bioidentical hormones can't cause cancer, if you have cancer, they can feed it. So there's a different strategy in perimenopause than there are in menopause, and the best way to navigate which one is for you is by working with your doctor and getting hormone tests yearly. There's different types of HRT, hormone replacement therapy, and I'm going to talk about them now. The first and the most safe type is hormone replacement therapy using herbs. So these are phytoestrogens and phytoprogesterones. They can come in tablets, teas, and sometimes they actually come in creams as well. They can also be bought over the counter in some cases. So phytoestrogens have estrogenic activity. Phytoprogesterones are plants that have progesterone-like activity. Even if you're taking them, I usually recommend that people are taking them based on the fact that their labs are telling them that they need them. And these can be prescribed and recommended by naturopathic doctors, functional medicine people, and also integrative medicine doctors. The next level of safety is bioidentical natural. Bioidentical natural are usually recommended by your doctor, but they're made at compounding pharmacies. The estrogen comes from a soy derivative, and the progesterone comes from Dioscorea, the Mexican wild yam. Ultimately, they are made and they are exactly bioidentical as the estrogen and progesterone in your body. They typically come in a cream form, and they can be changed. Their doses can be, adjusted and customized according to what you need based on your labs. The next level is bioidentical synthetic, and these can be prescribed by your medical doctor. Often the insurance pays for them. They're bioidentical, meaning they're exactly the same as the hormones in your body, but they're made synthetically, and they'll just say estradiol and progesterone. They typically come in tablets or capsules, but they can often come in patches, and a lot of times the insurance company will pay for them. The level that's above that is a level that I never recommend, and that's non-bioidentical and synthetic, meaning that these are not hormones that are the same as the hormones in your body. For example, you may have heard of Premarin, pregnant mare's urine. It's an estrogen that comes from a pregnant horse. There's also things like Prometrium and Provera, or there's progestins, which are progesterone-like, but not really progesterone. I don't believe that it's necessary to ever take these kind of hormones. These tend to be the ones that have the most negative side effects and the worst consequences if somebody has any kind of fibroid cysts, endometriosis, or breast cancer. So I always recommend with HRT that you start with the least invasive herbs and work your way up to the bioidentical natural or the bioidentical synthetic, but to avoid the non-bioidentical synthetic hormones for your safety. In general, all bioidentical hormones and HRT should be based on labs, and you should be tested every year, as well as you should be getting monitored for your breast, your ovaries, and your uterus to make sure there's nothing suspicious as far as cancer goes. So I hope that helps you understand the different types of HRT. Thank you so much for joining me on your journey through empowered menopause. I hope you're feeling much more informed, supported, and inspired to embrace this transition with confidence and clarity. Make sure you subscribe to my channel so you can continue to get all the videos in this series, where we will continue to explore powerful and meaningful ways to empower you on the midlife transition and beyond. Your transformation is just beginning, and I'm honored to walk this path with you. I look forward to seeing you in the next video.